Commissioner Hiddleston, in Delaware County, I've been noticing that the numbers are far above, nearly 10% higher than the statewide average in some categories as far as getting people vaccinated. That's very impressive. You guys aren't a small county. How is that possible? And what are you guys doing that it seems to be a little bit better than the rest of the state?
Well, Kristen, thank you for asking that. And I would love to take credit for that. We have an amazing team here. Our team has worked tirelessly through this entire process, and I'd love to take credit, but we really can't do that. I can't speak to why our entire county's numbers are so high. What I can tell you is here at the health district, we've been running clinics 6 days a week. We have a clinic every single Saturday, and a lot of times we have a Sunday clinic also. I think one of the things that that does do is give an opportunity to people who work Monday through Friday an opportunity to come and get the vaccine, whereas maybe some other areas are not able to do that. The other thing, though, that probably plays a little bit bigger picture is in Delaware County, we do have the majority of our community do have access to health care. And so they do have opportunities to get that vaccine. Whereas in some of our smaller counties, perhaps some of our more rural counties, they may not have the access that we do have here in Delaware County.
What was most impressive is your senior citizens. In my opinion, you guys, I believe the number yesterday was almost 82% of those 65 and up were vaccinated. Talk about that, if you don't mind, and why was it such a priority for you guys to make sure that our most vulnerable population was vaccinated?
Well, I think that we were probably very strict in the beginning of not allowing anyone else in. And while we didn't make a lot of friends during that time, we really truly did reject those people in our registration process that didn't meet the criteria. The other thing is we have an excellent partnership with SourcePoint, which is our area agency on aging group here in Delaware County. And we worked really closely with them to make sure that we got the word out, people got registered. They're still, in fact, helping us. We're doing a clinic today in partnership with them where we had the library and SourcePoint call people, particularly in that age group that didn't have access to the internet, get them registered. They worked with Delaware County Transit to get transportation to a clinic in order to get those people vaccinated that perhaps had those barriers to getting that vaccine. And that's just been really important to us.
As the vaccine eligibility opens up vastly over the next few days, what is your goal as a health commissioner there, as far as getting the younger people now vaccinated?
So we are continuing to really look at those tiers that were there. We have not opened clear up. I know the governor did say this week that in counties where they were having a hard time filling their appointments, they could open it wide up a little earlier. We have not done that. We still have lots and lots of people who are in the current tiers that are trying to get appointments. We're booked into April. We're giving over 1,000 vaccines every week, most weeks, and still not able to answer everyone's needs. So we hope to have more vaccine very soon. We hope to be able to open that up. What we do is regularly schedule so many appointments every week, so many for first appointments, so many for second. And then if we get a surprise shipment of vaccine, which happens sometimes, then we just add those appointments kind of on the fly. That happened a week ago. We ended up with an extra 600 doses we weren't expecting. We put those out on the street and they were all taken within that first 24 hours. And we'll continue to do that. We currently do not receive any Pfizer vaccine, so we're in the planning stages with how will we take care of our 16 and 17-year-olds. Will we work with a surrounding county who is getting Pfizer vaccine, doing some trading in order to get some of that? Or will we maybe just partner with them where we'll do a joint clinic and be able to do that? So we're still working on that.
Excuse me. It seems like those vaccination slots, like you said, they fill up very quickly. How are you guys communicating with the public about those slots? And it seems like it's been a very good response to wanting to get vaccinated. Like you said, you're booked clear into April. Has there been any kind of special messaging? How are you communicating with the residents of Delaware County?
So our social media team, communications team, Tracy and Megan, they do a really nice job. We're using all various venues. We're also working with our partners. They're helping us to spread the word. Our townships, they often put that information into their newsletters. So really as a community, again, working to make sure that the word gets out there, using all of those various methods. It's on our website. I think that, the frustration with the communities, and this is across the state, the frustration hasn't been with the registration as much as it's been with the lack of the vaccine. And as that really opens up and we understand from the governor in the next couple of weeks, we're really going to see more vaccine rolling into the state, then that's going to become easier and easier. I will share that we're starting to see a little bit of a no-show rate, and it's starting to creep up a little bit. And that's concerning to us as a health district because we know we still have people out there that really want that vaccine. And so when I look at our numbers the day after and I see that we had 10% of the people who were scheduled not show up, that's maybe 20 people that could have got the vaccine that wanted it. So we're really starting to monitor that. And we will start overbooking a little bit if that becomes the case so that we don't end up with people that could have gotten a vaccine that didn't because we have people that didn't show up. Now, we're not wasting any vaccine. We have a short notice list. Every single vaccine that we've received has gone into someone's arms. And so we don't waste it, but we hate to have somebody miss an opportunity.
Absolutely. So, like you said, the governor mentioned that in the coming weeks, and we'll probably hear more about it today, actually, when he holds his press conference, there's going to be a lot more of the vaccine coming into the state. I talked to the lieutenant governor last week, and he said we're going to get to a point where we have more vaccine than perhaps people who want to take it. And we're going to have to start kind of like you do with the flu shot, going into people's workplaces, maybe going into the high schools to get those 16 and 17-year-olds. Have you guys thought about that and a strategy for that?
We have. I mean, those are the things that we do every year. We do a big back to school push where we go into our various school districts at the 7th grade level or the kindergarten level, because those are the students who normally get it. So we would look at those strategies to see how that would work. Obviously, we're not going to kindergarten because we don't have a vaccine for them yet, but we would look at that. We generally go, we have some senior citizen apartments and we go in those. We have a program called In Your Neighborhood, where our team goes out to various pockets of need and we provide different services there. So we'll look to taking the vaccine out to those. And again, really working with our partners. We are currently working with our EMS providers to do the home visits. So we do have a fair number of people who've said, I just can't come to a clinic. So as soon as that Johnson & Johnson vaccine starts rolling freely, we're going to start doing more of those home visits and getting out there. Really a great vaccine for those home visits because the persons that are at home are going to have that full protection within 2 weeks and be able to start having visitors. So we're real excited to be able to offer that. Again, the governor tells us that about the week of April the 9th, we should see that start rolling in.
So not really a secret sauce, just like a continuation of things that you guys have done even prior to the pandemic that's helping the citizens of Delaware County get vaccinated at a higher rate than the rest of the surrounding counties. Maybe others will reach out to you after they see this, and I know you're very busy, so maybe I shouldn't encourage that.
We in local public health have been practicing mass vaccination for years and years and years. We all have plans. We've all been working together on these exercises. So local public health knows how to give mass vaccination. So I think that this has been a great opportunity for us to show our community that all of the dollars that have been put in by the federal government in this emergency planning were really for good. We know how to do this. We had a clinic, I'm sure Tracy told you, we did almost 5,000 vaccines in one day because we know how to do this. So we do it well in Delaware County, but it also is not without the help of all of our partners.